brief update on the Government of Canada's vaccine procurement efforts. From the beginning of this pandemic, our government has committed to protecting the health and safety of Canadians by securing access to safe and effective vaccines. As a result of our diverse portfolio of vaccines and our contracts with Pfizer and Moderna specifically, as of July 27th, Canada has received more than 66 million doses of COVID-19 vaccines. This means that the supply is here for every single eligible person in Canada to be fully vaccinated. This milestone was reached a full 2 months ahead of the original goal of the end of September, and it is a direct result of our aggressive and proactive procurement approach focused on capitalizing on a diverse portfolio of vaccines. Au 27 juillet, le Canada avait reçu plus de 66 le feuille de of the developing world. PSPC will continue to work with vaccine suppliers to maintain Canada's supply and to help coordinate deliveries of donated doses to other countries. I would like to thank my Deputy Minister Bill Matthews and Associate Deputy Minister Ariane Reza and their team for phenomenal work in the vaccine procurement effort. Les doses canadiennes qui sont identifiées effort in the vaccination campaign. From town to town, city,
a great investment. I'm glad to report today that thanks to the generosity of Canadians, UNICEF Canada has already raised over $5 million in this campaign to date. That's awesome. Thank you. Canadians have the opportunity to donate to UNICEF Canada until September 6th. And the easiest way to donate is to send a text with the word vaccines to the number 45678 to donate $10. Je suis heureuse d'annoncer aujourd'hui que
reported daily, with the majority of new cases reported in the 20 to 39-year age group. After several months of declining severity trends, we're now seeing early signs of increases in severe illnesses following the recent increase in cases. On average, 511 people with COVID-19 are being treated in our hospitals each day, an increase of 12% compared to last week, and 206 people are in intensive care units, which has leveled off. Fortunately, the number of deaths remains low, with an average of 7 deaths being reported daily. Although we're heading into a fourth wave driven by the Delta variant, the good news is that millions of Canadians have rolled up their sleeves to help build a strong wall of vaccine protection. The vast majority of cases and hospitalizations are in those not fully vaccinated. To date, more than 50 million doses of vaccines have been administered in Canada. More than 82% of the eligible population 12 years older have received at least one dose. And importantly, over 71% are now fully vaccinated, providing strong protection against symptomatic disease and severe illness. However, there are still millions of eligible people in Canada who have not been vaccinated, and coverage is not even across age groups. In particular, during this last stretch to increase vaccine uptake further across all age groups, we need to build up momentum to increase coverage among young adults, the age group where most of the transmission is occurring. This could help reduce the size of the fourth wave this fall and winter and help limit its impact on our healthcare system. As well, the Public Health Agency of Canada, along with the National Advisory Committee on Immunization and the Chief Medical Officers of Health, are working with experts across the country to closely monitor emerging evidence on the potential need or benefit of a third dose in certain populations, including those who are immunocompromised. For now, our top priority remains ensuring as many people in Canada who are eligible are vaccinated. Together, we have made a lot of progress, and now is not the time to stop. To increase people
71%
And to avoid having
l'enseigne.
Minister Anand, how safe would it be to hold an election in Canada now?
Yes, it's Theresa Tam. So I think what we offer is public health guidance to Elections Canada and link them to local public health authorities. As we've seen, we've done many things in society, opened up different spaces and having safety plans in place throughout this pandemic. So there's a lot that's been learned about how to make these kind of voting spaces, if you like, safe. So I think the key advice is really to observe all those good practices, and that would then make safe voting possible, whether it's the social distancing and mask wearing and all of those measures that everyone's pretty used to by now. But you do have to watch the local epidemiology and the local public health advice as well. So that could vary over time. And I believe that Elections Canada has other provisions such as mail-in, which is also a good idea, on top of safe practices at physical locations.
I don't have much to add to Dr. Tam's comments, only to reiterate the importance of following public health guidelines regardless of the situation, and get vax to the max, as Dr. Tam and Dr. New have indicated is so important for our country regardless of the situation. Place for Canada.
Yes, thanks. I guess Dr. Tam and Minister Anand, I'm less referring to the idea of, can we all, send in a ballot by mail, or can we show up at a voting booth safely? I mean, I think that you're right, Elections Canada is focused on that. But I guess I'm asking you, Dr. Tam and Minister Anand, in your backyard, Minister Anand, in Ontario, we're seeing cases double. The epidemiologists are very concerned about a campaign. So, Dr. Tam, could you address the specifics of what your expectations are of federal political party leaders in terms of campaigning in these areas? Do you want to see federal party leaders, do you think it's safe for them right now and the entourage that follows them to go in and campaign in regions like where you're seeing this fourth wave resurge? And especially given that many of the participants, the workers and whatnot, are in that age group you referenced. Could you speak to the actual campaigning, and Minister Anand as well, for you, your actual campaign? How do you manage that?
Yes, this is Theresa Tam. I'll start. And there are public health measures that people have to observe, including local measures on gathering sizes, but also best practices in any of those gatherings. Mask wearing being one of them, outdoors being better than indoors. I would say that encourage everybody who is going to show up any gathering should protect themselves maximally, which includes vaccinations. So I think, again, just as other, you're talking about, voting and making that safe. Absolutely. I think anyone who's sort of campaigning must observe those best practices and follow local public health guidance as well. There's different rules being applied in different areas of the country, and you can't exceed the capacity, for example, of some of those gatherings. But regardless of those rules, I would just say layer on as many protective measures personally as you can, which starts with the vaccine, masking, hand hygiene, don't show up if you're sick, all of those things. I do think that the size of the gathering does matter, and how you can control the crowd in terms of their behavior might come into play. There are definitely best practices on how to do that.
I couldn't agree with Dr. Tam more, regardless of whether it is an election, a picnic, a concert, or a sporting event.
on doit suivre.
Do you think we need perhaps a more heavy-handed approach? Do you think we need vaccine passports for everyday activities? Do we need mandates from more employers and the government, essentially forcing folks to get a shot if they want to move about freely? Is that the best way to close the gap now at this stage? Because, supply is working enough to really get us to that.
First of all, as you've said, I do think we've done remarkably well with vaccine uptake. So just kudos to everyone who rolled up the sleeves, because we must acknowledge that we have been successful to a huge extent. But that last mile, as everybody calls it, is a very difficult one. And I think that's precisely why the Prime Minister has asked for this to be examined thoroughly, and including every policy that is at the disposal of the employer and the federal and Treasury Board and the federal government setting. So I do think that that is being looked at for sure. Both the, as Howard New has said, the carrot, the stick, and everything else in between has to be examined, from all angles. So, I would say just stay tuned on that front, but everything is being looked at.
It's Dr. New. Maybe I could just add to what Dr. Tam said. You're right. If you look at the public health objective, really, is to, get as many eligible Canadians vaccinated as quickly as possible. And once they have
more work to do, and I will continue to be focused on working for Canadians, regardless of whether there's an election called or not. Thank you.
It's Teresa Tam, so it's not my role to advise on whether an election should occur or not. I think the role of the Public Health Agency is to provide guidance should an election takes place, and how to do that safely. Many things are going on in society right now in terms of daily activities that requires safer approaches we can manage to our job is to.
And as well, if you have a timeline on when you will know whether boosters will be required or will start being handed out or not.
Yes, it's Teresa Tam. So based on the data provided from the provinces, you've seen some of the graphs, if you like, that was presented at our modeling session that's on the website, and you can get more data from the web updates, but there's very few breakthrough infections after 14 days from the second dose. And when, based on the information that we're seeing, those, for example, in hospitalized cases, the last time we did an estimate, which is sort of being updated on an ongoing basis, is definitely less than 1%. It's like 0.7% of mass at the time.
Thank you. We will take the next question.
Thank you. Merci. The next question is from La prochaine question est de.
Canada looking at vaccine passports for international travel. What kind of things are we looking at when it comes to people that may have a mixed vaccine dose, such as Pfizer and Moderna?
Components, I think, first of all, of course, Canada is going to accept the travelers who have the vaccines on our list for fully vaccinated individuals, and in any different combination. So that's one thing, and we're, I would say, leading the world in that kind of policy. And then we're engaging other countries, not surprisingly, some of the European countries who've already gone with a mixed dose approach. And so, because, people, quite frankly, are just working out those requirements right now for international travel, but we are linking with those countries who are fortunate enough, first of all, to have had the vaccine for longer and more populations vaccinated. So, so that is ongoing. And I would just point to also the recommendations of the WHO and their SAGE, that's a committee that's a bit like NACI, but at the WHO level, who's actually looking at this as well. That's really important when it comes to the world accepting mixed doses. And I know that in one of the latest updates, they point to the fact that, under certain circumstances, the mixed schedule might be appropriate. And so all of this is evolving. And I think I just ask for travelers to be patient and to consult what the requirements are of other countries. So we're tackling the question at sort of both ends, coming into Canada, but also country accepting the Canadian approach, if you like. But we're by no means the only country. So we are trying to sort of leverage others as well. And so you may have seen, I think, just in the last week, I believe, a study coming out of Denmark with a vaccine effectiveness for a mixed dose approach. And so all of this is evolving, and countries want to know that kind of data. And so by providing that kind of evidence, we will advance on other.
And sorry, one sec. And just with the vaccine passports on the federal level, just how would they work with the provinces to access that health data that likely would be required, verifying when travelers got their various doses and what dose they specifically got?
Yes, thank you for the question. And I think this is not an area that I lead in, but I do know that there's been some really great meetings and discussions with provinces and territories. I think they're all keen to see Canadians able to travel with a vaccine proof. I do think ArriveCan is a very sort of world-leading solution in terms of people coming back into the country as one of the contributions. But I think all provinces are keen to work with the standards as well as how that credentialing is going to work. As well as, of course, all the arrangements in terms of data sharing as well. So I think that you'll see all of that work carrying on in the next weeks and into the early fall for some of those early updates.
Michael Swan, the Catholic.
25%, at least 25% of healthcare in Africa is delivered by the church. In rural Africa, it's over 50%. So I wonder whether the engagement with UNICEF, with the UN system, and large aid donors is bypassing a kind of a trusted and effective route for vaccines to get into more marginalized communities.
Thank you for the question. So I think it should be noted that UNICEF annually delivers about half of the world's vaccines to about half of the world's children. So they have excellent networks with healthcare workers who work locally around the world, including in Africa. And COVAX is also working with Gavi, or Gavi is managing COVAX, the Global Vaccine Alliance, which again delivers the vast majority of vaccinations to people in rural areas, in low and lower middle income countries around the world. So they already have extensive networks with local health providers, and they're using those networks that have been established over decades to deliver the COVID-19 vaccine.
Okay. A follow-up really for Dr. Tam. The WHO has come out very strongly against the idea of rich countries using booster shots, yet you're investigating them. Is Dr. Ghebreyesus wrong when he says it's immoral for rich countries to be talking about boosters when most of the world is unvaccinated?
Yeah, I think, thank you for the question, and it's a very important one. And, to protect Canada, the rest of the world needs the vaccine as well. I think in my the last media presser, I said that as a small country and with small groups of people that we're examining right now who might need an additional dose, we can do both. I mean, I think the first group of individuals in Canada, for example, the immunocompromised and others, we're not even talking about booster as much as it is, do they need an additional dose on top of the first 2 doses in order to even mount a reasonable immune response? So those are the questions that we're looking at. At the same time, though, when the National Advisory Committee on Immunization makes recommendations, it's not purely on science. It is also takes into account other considerations, including ethics. You've seen how we prioritize at-risk populations first in Canada when there's a limited supply. So our ethicists are being consulted at the same time as we are making the scientific analysis on that additional dose.
Thank you. That concludes today's press conference. Merci.